Welcome to Health Workforce Australia's second quarter report for 2012. Today, I'd like to update you on key pieces of work that Health Workforce Australia is undertaking. The first of these is Health Workforce 2025. On the 27th of April this year, Australian health ministers approved the release of Health Workforce 2025 doctors, nurses and midwives. The report uses the best available planning information to identify our workforce requirements out to 2025. Importantly, it identifies the numbers of professional entry students and postgraduate training places that would be required for doctors, nurses and midwives out to 2025. For doctors, the report identifies a workforce coming into balance. In the short to medium term, there is likely to be an oversupply of junior medical officers. However, the workforce then moves into balance, if not back into shortage, by 2025. It highlights the need for reform in a number of key areas. The first of these is training. It is important that due to the growth of medical graduates in Australia, we have a more organised approach to training doctors to become specialists and general practitioners. The report highlights a continued reliance on international medical graduates to meet workforce requirements within Australia. While this will be somewhat less than has been in recent years, it is important that Australia takes a more organised approach to the recruitment, retention and support of international medical graduates, particularly those working in regional and remote areas of Australia. Above all, our approach to immigration must comply with the WHO Code of Ethical Migration. Geographical distribution of medical practitioners is likely to remain a significant challenge throughout Australia. It is important that as we are graduating more Australian-trained doctors, that we revisit the policy levers and measures that are in place to improve the geographical distribution of doctors. For nurses, the report identifies continuing shortages increasing in magnitude from 2016. Training alone will be insufficient to meet the needs of our health workforce. We must focus on reform. Reform in the way that we're training nurses, reforms which improve retention in the workplace. And above all, we must equip nurses and provide them with the assistance they need to be able to perform the range of tasks for which they are trained so that we're able to retain them in the workforce as long as possible. The next steps in Health Workforce 2025 are firstly to complete medical specialist modelling, which we'll bring back for consideration of health ministers later in 2012. The second key step is to identify those policy measures which will need to be put in place by governments, employers, the higher education and training system to address the challenges identified in Health Workforce 2025. Health Workforce Australia will be hosting a workshop of senior leaders in the Australian healthcare system facilitated by international health experts on the 5th and 6th of June 2012 to formulate a response to Health Workforce 2025. The Health Professionals Prescribing Pathway aims to develop a nationally consistent approach to prescribing by health professionals other than medical practitioners. Its aim is to encourage safe prescribing and flexible use of the skilled workforce to be able to deliver a more comprehensive model of care to patients. It will build on work undertaken by other organisations such as the National Prescribing Service to ensure that we have a skilled workforce that's able to deliver quality care safely. The project will also identify educational requirements, regulation and legislation issues to enable safe prescribing by a wider range of health professionals in the delivery of care to their patients. For health professionals, this means they're able to practice up to their level of skills and training. For consumers, this means more timely access to health care. We're currently undertaking national consultation with a wide range of groups on the prescribing project. We encourage you to participate in this exercise by visiting our website www.hwa.gov.au. Immigration of international medical graduates will be a key component of meeting Australia's health workforce needs for the foreseeable future. It is important that as international medical graduates seek registration within Australia, they are given the maximum possible opportunity to pass the relevant exams and be supported in this difficult transition. Health Workforce Australia is working with other organisations to expand the availability of workplace-based assessment for international medical graduates. We'll be supporting 3 key projects in the Hunter region of New South Wales, Tasmania and Western Australia, as well as a number of national projects, one of these in partnership with the Australian College of Rural and Remote Medicine. By supporting these activities, we will be able to increase the availability of international medical graduates to meet acute workforce shortages, particularly in rural and remote areas of Australia. Workplace-based assessment offers a number of advantages. It provides ongoing support and orientation within rural and remote Australia and increases the likelihood of them achieving registration within Australia. In May 2012, we'll be launching a new e-newsletter, Health Workforce Insights. This is Health Workforce Australia's way of communicating the range of projects and activities that we are undertaking as we lead a national program of health workforce reform. If you'd like to receive the newsletter, please go to our website and subscribe, and that way we'll be able to keep you in touch with all of the developments in our work program. Finally, I'd like to invite you to our inaugural conference to be held from the 12th to the 14th of November in Melbourne. We've called it Inspire 2012, Reshaping Australia's Health Workforce, and we believe that it will live up to its name. You can register your interest in the conference by going to our website. In closing, Health Workforce Australia looks forward to working with you as we implement our national program of health workforce innovation and reform. You can follow our progress on the website, via Facebook or Twitter.